I wonder what your thoughts are about trace testing and how it would work. How would it work?
So the way it would work initially is we would get tested to see whether or not we have antibodies, which are basically a mechanism in your body that is fighting off infection. So if you have antibodies to a particular virus, then we say you have immunity. And that's really the purpose of vaccination. But getting an infection is part of how you develop the antibodies and ultimately the immunity. So we would test you to see if you have those antibodies. We would then declare that you have some immunity to this virus, and therefore you can go back out to work. You're not going to risk infecting anyone, and you should not be susceptible to getting another infection. However, again, in African American communities, other minority communities, and immigrant communities, I worry about that because once that testing is done and you have shown to be immune, the question is, did you have an infection at some point from the virus, and therefore who else did you come in contact with? And that's where the contact tracing comes in. So if you tested positive, we now will ask you, who have you been around? Who have you been interacting with? And I think that in minority communities, with the level of distrust of the government, that could be a tough sell. And so I would urge all the municipalities that will be looking at this, especially with large African American populations, to really engage community leaders and others to ensure that that aspect goes well and that the distrust does not avoid people from participating in this process and therefore potentially not being able to get back into the economy as it reopens.
I wonder where Howard University stands on this, because the government is going to be asking nonprofits and for-profits and universities like Howard University to step up and be part of this process for testing and contact tracing. You've acknowledged the fact that there is some significant distrust within the African American community. I mean, what's your message here? What do you want people of color in various communities to know about this effort?
Well, I think the first thing is we have to make sure the community leaders that are naturally embedded in those communities are respected and engaged. We really need to reach out to them and have them be at the forefront of helping us enact this. At Howard University, we're going to get several departments involved. Our Department of Sociology, we have an African American Studies department. We have a psychology department. We have a School of Social Work. We have several different options, a public health program, to really get them together and have a conversation about what should be done in this. How can we, as an institution, participate? And we now see patients in Ward 7 in that neighborhood. And so we are also willing to try to stand up a testing site at our current facility as well, to aid in the testing and to continue to encourage the community to come out and be tested so that we can learn more about what's taking place in those particular communities.
Are you concerned about the people who would be venturing out for tests? I mean, if you're in Ward 7 and 8, that's at least 2 bus rides. So you don't know whether you have COVID-19. You could be potentially exposing yourself to someone who might have it or not. Then I'm asking you to come to the hospital to be tested, an area that you may be nervous about coming to anyway. And so is there some question about how this would work and whether that whole scheme of things would even work, given all the steps that you'd have to take just to be able to take the test?
You make an absolutely great point, Leslie. As a matter of fact, the mayor has set up a testing site at United Medical Center, which I think was extremely well thought of, so that there is one in the neighborhood. And then we actually have an ambulatory care site in conjunction with Unity Healthcare, where our subspecialists actually see patients. And that is located in Ward 7. So what I'm proposing is that we would actually take the test to the community. I also think right now we need to be considering a mobile testing opportunity that can actually go through the neighborhoods and provide testing to the community at their sites. Actually go door to door and provide the opportunity for that testing in a safe and appropriate opportunity. We have a mobile van that we take for screening. in Ward 7 and 8, we would be willing to set that van up appropriately to test people as well in a socially distancing manner. So all of those are techniques that I think can be employed in order for us to get this done well.
It's this whole idea of meeting people and meeting the need where it is. We talked about the disproportionate impact that COVID-19 has had on African Americans and communities of color. But this week we're getting some new race data from D.C. that gives us some additional detail about the staggering number of both losses and diagnoses. What are you reading into this information?
Again, I think that one of the things that we must read into it, and one of the things that we must be thoughtful about and be concerned about, is whether or not we are really having interventions that put aside some of these disparities. And I think when you look at before this occurred, if you just simply look at life expectancy, if you live in Ward 8, your life expectancy on average is 72 years, 95% of the population is Black. If you live in Ward 3, where 95% of the population is white, your life expectancy is 87.6 years. That gap right there portends a poor outcome depending on any other factors that may exist. And the reason it exists is because of the underlying conditions that the patients in Ward 8 are more susceptible to. And that goes over a wide variety. It includes things like maternal mortality, is much higher in Ward 8. When you look at diabetes and kidney disease, much higher in Ward 8. Hypertension, much higher in Ward 8 as well. So what we have to do is to really come up with a system that tries to address all of the issues with respect to the social determinants of health. The pandemic is exposing it yet again, but every now and then we get a flare up of a story, whether it's maternal mortality rates or something else that exposes this. But we have to start looking at access. We have to start looking at food. You have 2 grocery stores there. We need more opportunities for fresh fruit and vegetables. So we have to look at all of those and how we can mitigate those risks.
What can we be doing in our own families, Dr. Frederick, to really convince our family members, our extended family members, our communities at large to do something? Because, people may hear this and they may think, oh gosh, this is so overwhelming. What can I do to do my part? And so I pose that to you both, not just as university president, but as physician, as father, as husband, as community leader. What can we do?
Yeah. Well, the first thing is I think we have to take personal responsibility. We have to stay at home. We have to model the CDC guidelines of washing our hands, of physically distancing. I know people are a little uncomfortable with the social distancing term, but physically distancing, staying at least 6 feet away, if not more, from strangers, wearing a mask when we go out. And when we go out for the appropriate reasons. If you're an essential worker heading to work, or you're getting groceries, and that should be it. But we have to model the behavior first and foremost, I think, within each of our homes. And as you rightly just said, you, Leslie, are a pillar in the community. People listen to you, you're a trusted voice. And if they see and hear you pushing those messages, then they're more likely to follow it. But if we do it with our own families, and we get our own families to tell their friends, and their friends to continue to tell their friends as well, and we continue to push that message, it will help. We intend to roll out at Howard University some PSAs as well, using some of our prominent alums to try to speak directly to the African American community and to our Howard University community about modeling this behavior before a surge hits DC.
Last question for you. And outside of race, are there some parallels between people who may live in rural areas who also have limited access to resources and distrust, and whether there ought to be some concern about them being tested as well, regardless of race? I'm talking about just in the rural areas.
That's a very good point. I mean, when you look at rural areas, you actually have some natural physical distancing, and the populations tend to be much smaller, so the opportunity for congregation is probably less as well. But to your point, if they are traveling into more urban areas for work, it would be helpful to make sure that we make an effort to get them tested as well, and to give them opportunities so they can be tested. Over 3 million people have been tested in a country of 300 million people. You think about that, it really sounds like a drop in the bucket. And yet still, the numbers of people who have actually contracted the virus is more than any other country in the world. And the number of deaths in this one country are also staggering. So with that in mind, we really have to make an effort to try to get people tested so that they can appropriately self-isolate and not transfer the virus to anyone else, so that we can stop the spread until we have a vaccine that can then give all of us some type of immunity.
One last question. If all of us need to be tested, I'm just thinking about just in the DMV. I mean, you think overwhelmingly, it's pretty overwhelming when you think about everybody in the nation, but what would that look like for this entire area, the DMV, for all of us to be tested in some way? How could that be done? How long would that take? I mean, because until we have a vaccine, if we don't know if we've got the antibodies or not, and this stress need for testing, how do you get there?
That's an excellent question. And actually, we probably don't need to test everyone, but what we should start doing is testing the most vulnerable. So for instance, if you know that African Americans with underlying conditions and other underrepresented minorities with underlying conditions are more likely to succumb to the disease, then we can start there and really start making sure that we test them. You know, elderly patients are likely to succumb to the disease, and those who may be in contact with them. So we can set up criteria to start with, and then you build the testing out based on that. And as you begin to test that population, as it will, or those subsets, you can then build a matrix of who else will need to be tested. And you can also build a probability of who likely would have been infected based on that population that you've tested. So yes, it would be overwhelming to test every single person, but I think if we start there, it would be helpful. And then you have to think of the things such as school is out right now. So how do you decide on bringing kids back to school, teachers, etc.? So again, you may prioritize testing teachers as an example. And at universities like ours, and in my opinion, this is a big college university town, we have to be thinking about when all of those students start coming back into the city, what do we do? And they're coming from other jurisdictions. Do you require them to get a test before they come back? So there's several ways that we can test quite a bit of the population, even if we don't test everyone, but test enough of a sample to get a better sense of what the chance of spread and the chance of infection is in the various different parts of the population.
Well, we know that getting to the finish line of this will be more like a marathon, not a sprint, and we have many more miles to go. But I thank you so much for your time tonight, and I look forward to talking to you in the future as this testing and tracing continues to unfold, and the efforts of Howard University and the additional hospitals and other organizations in this area work to try to make sure everybody is healthy and safe, and we can stand up this community again. So thank you.
Sure. Thank you very much.